Hey, what's going on? Dr. Taylor, Chiropractic. Today I want to do, it's going to be a tongue twister. I want to throw some big, stupid Greek words at you. Generally speaking, they all fall under the term spondies. S-P-O-N-D-Y-S. Spondies. What are spondies? What are spondies? See? Tongue twisters. So, these are going to be three variations of issues that you can have with the neck or low back. We see a lot of low back stuff in relation to these, but these can certainly happen in the neck. The first one is spondylosis, S-P-O-N-D-Y, spondylosis, L-O-S-I-S. So basically what this is general wear and tear on a joint in the spine. Spond means spine, okay? So that's kind of our root word here. So spondylosis is, think of it like arthritis, okay? So if we've got a bone and a bone and a bone and we've got these discs between them, we should have these nice smooth edges, these nice rounded corners. Spondylosis is this stuff starts to get chewed up, for lack of a better word, okay? Not uncommon in any way, shape, or form. If you live beyond 40, you're going to have some spondylosis going on. Fun fact, only animals that don't get arthritis, sloths and bats. Bats hang upside down and decompress every night. Side note, we've got decompression here, and sloths don't move enough. Okay, anyway, back to this, the tongue twisters. Spondylosis. Next one, spondy, P-O-N-D-Y, lysis, L-Y-S-I-S. What's Lysol? What does Lysol do? Gets rid of dirt, right? Dirt and germs. It cleans your coffee table. To lyse is to break down, okay? So, spondylolysis. We're going to look at the lumbar vertebra for this example. Okay, so we've got the body of the vertebra. We've got the body of this vertebra here, right? So this is the front. This is the back. And we've got our neural foramen here, the lateral foramen, the lateral recesses, if you will. But what happens is we got this chunk back here, and this is kind of where your vertebra interlock, right? Right here. These are called articular pillars in the neck or pedicles, but basically it's these little. It's almost like a French. Is it a French shelf? I think it is. A French cleat. For any woodworkers we got there, this is a French cleat. Okay, so we've got the front out this way, we've got the back out this way. We've got our pedicles here that come down. So spondylolysis, lyse, to break up, is what's going to happen. Is there's going to be something here, or potentially something here where the bone has these microfractures, these little tiny cracks. You can call it a fracture if you want. Technically, that's correct. But what happens is we get these little cracks in here because we get the stress that's pulling the bone forward, pulling the bone forward. What causes stress that's going to pull the bone forward? Here, I'll give you a hint. This is still the front. What is that? It's a big old belly, right? Because what that does, that puts a big old curve in the low back, pulling that center of gravity forward. And that puts a stress on these vertebrae here that causes these little micro tears, micro fractures going on. Spondylolysis. This thing starts to break down. Now, the last one, and in the hierarchy of these three, the most severe and the longest word, spondy, S-P-O-N-D-Y, listhesis, L-I-S-T-H-E-S-I-S. Spondy means spine. List means to shift. It means shifting spine. Think of a ship, listing left, listing right, okay? So what that is, again, if we've got our vertebra here, like that, is the vertebra above, in this instance, will shift forward, right? So we'll get those micro tears, micro fractures in here, and then all of a sudden a gap will start to form in there. We will lose contact with this part of the bone back here. So again, we've got our spinal cord going through here, like that. And this chunk of bone, let's say this part here, will start to slide forward, okay? So if we take this whole thing here and we draw it over this way, it'll look something like this here, like that. And now you can see this hole here, or this canal where your spinal cord is, right in through here, how that's all lined up. All of a sudden, it's not lined up because this vertebra here starts to slide forward. The spine starts to list. The spine slides forward here, starts to put pressure literally on the spinal cord, certainly on the nerves that come out of the spine here, and absolutely on the discs that we have between these vertebrae. Because again, if we've got this thing going on here, that disc is nice and right where it needs to be. The pressure is just going from top to bottom and bottom to top. But now we've got this shearing force that is stretching this disc out, pulling it down and forward like that. And more often than not, we're going to get this spondylolisthesis. It's not going to be traumatic. It's going to be age-related. So we're going to have that spondylosis in there. We're going to have these torn up, crappy joints here also. That's going to cause a whole lot more pain, aggravation, immobility than just the general arthritis. So what do we do to fix that from a chiropractic standpoint? And what do chiropractors do? We move bones, right? Chiropractic comes from the Greek word meaning done by hand. So let's go back to this. We're going to draw the spondylolisthesis. We're going to draw it laying on your back though. So you come in and we've got here, let's just go like that. There's L4, L3, L2, L1, but we've got that sliding forward thing. Again, this is you from behind, like that, boom. We've got that sliding forward thing, so when you lay down on our back, all of a sudden our L5 looks like this, right? Like that, boom. This is actually kind of difficult to draw sideways. Here, 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 here. Aha, got it. So now, as a review, remember we're laying on our back, our spinal cord is going down the spine like that. Ah, crap, there's that spondylolisthesis going like that. And we've got these nice big open canals here for the nerves to come out. Ah, crap, that one's being pulled out. And then not only that, remember we've got our nice healthy discs between the spine, or bones of the spine. Ah, crap, this one's out of alignment here. So what do? We decompress it, right? Not only do we decompress it, but we decompress it with weight. Weight going down and weight pulling away. Because what that's going to do, that's going to increase this gap here. And the weight here is going to give this vertebra a place to go, right? Because we need to move that thing back. In the most general sense, the job of a chiropractor is simply to make sure these nerve holes are lined up. And this spondylolisthesis, this is the most traumatic, traumatic's a rough word. This is the grossest way, not gross as in icky, but gross as in large scale. This is the grossest way that these nerve holes can come out of alignment. So by putting these bones back in place, literally by hand, by decompression, by weight, we reduce the spondylolisthesis. We line up these vertebrae here. This thing will start to come back like that. And all of a sudden these nerve holes will start to line up again. That'll go away there. And all this pain and stuff that this is causing, it's going to be low back pain, it's going to be hip pain, it's going to be sciatic pain, stuff shooting down the leg. That will go away. Why? Because we took those nerve holes and we lined them back up. Safely, naturally, without drugs, and most importantly, without surgery. Because you know what sucks about surgery? Actually, you know what's great about surgery? It works 50% of the time. You know what sucks about surgery? It works 50% of the time. And you don't know which side of the 50% you're going to fall on. So, this spondylosis, spondylolisthesis, spondylolysis, these are regular spinal problems that come into the chiropractor's office every single day. And adjustments alone will certainly help these. But if you can put some other stuff on top of it, prescriptive exercise, and most certainly decompression, like we have here in the office, this stuff will go away. I promise you, I've got x-ray evidence of it. We fix this stuff all the time. The crappy part about it is it takes time. Because this thing here, comes in grades, right? If we've got our blocked vertebra here like that, and that thing is sliding forward, there's a grade 1, there's grade 2, all the way up to grade 4, where that thing is falling forward off there. Grade 4, those are surgical. We'll get you to the right guy for that. But everything under a grade 4, shoot, I saw half a dozen of these this week alone. So if you got some low back stuff going on, if it's chronic, God forbid, if you're somebody who's like a truck driver or somebody who sits a whole bunch, this is the kind of thing that you need to be looking for. This is why we do exams, and this is why we take x-rays. You can't feel this thing, you can only see it. But once you see it and you know that what you're dealing with, you know how to fix it, or at least we do, right here at Chiropractic. We're ready to help you when you're ready to be your best. naturally.